So the structures responsible for the balance, there are two of them in a ear. Vestibule, semicircular canals. So vestibule, which is the part of the bony labyrinth, houses two sacs, saccule and utricle. Okay, saccule is closer to the cochlea, and utricle is closer to the semicircular ducts. These two parts, saccule and utricle, are responsible for sensing the linear acceleration of the head, meaning moving forward, backwards, left, right, and all the combinations. The sensory receptors in saccule and utricle are called macula. You can see them here. Okay. They are immediately responsible for sensing the movements. Semicircular canals, right here, you can see them in this model. They contain semicircular ducts, shown in blue. Semicircular ducts inside at the end. They have structures called CRISTA AMPULLARES. Those are sensory receptors in the canals. Semicircular canals are responsible for sensing rotational movements of the head, like this or like this. Okay? Altogether, sensory receptors located in saccule, utricle, and semicircular ducts form vestibular apparatus. They sense our position and our movement in space. And they convey those signals to cortical regions as well as to cerebellum. So first, let's talk about macula being sensory receptors in the utricle and saccule. So one macula in each of those chambers. One macula in the utricle, one macula in the saccule. They respond to the linear acceleration. How do they look like? It's a flat patch of epithelium which contains hair cells. Now you know the structure of the hair cells. It's not something new to you, okay? Those hair cells are innervated by the afferent fibers of the vestibular branch of vestibular cochlear nerve. Remember that in the ear, stereocilia, I know where this model is now, stereocilia and kinocilium, they were projected into the tectorial membrane. In this case, hairs, stereocilia and kinocilium, are embedded into the membrane called otolith membrane. Otolith membrane contains a number of tiny stones called otoliths, which can be translated from Greek. Oto means ear, lith means stone, okay? Those are calcium carbonate. The function of the otolith is to make otolith membrane heavy and to increase its inertia. Do you understand the concept of inertia? When you press the brake when you drive the car, what happens to your body? You go forward because you have inertia. Does that make sense? When you push gas, you go backwards. Does that make sense? That's the idea of inertia. The idea of that membrane is to move back and forth, and to make it more effective, that movement more profound, we need to increase the membrane inertia. Now, macula of those two chambers have different orientation in space. Macula of utricle is practically horizontal, so it senses the acceleration in the horizontal plane. Macula of the saccule is vertical. This sensory organ is responsible for this movement, up and down. Does that make sense? Vertical acceleration. Got it? So what's going on during the accelerations, linear accelerations? On the bottom, you can see the fragment of the otolith membrane with stereocilia and kinocilium embedded into the otolith membrane. Now think about that. Here's your head, here's the exemplary hair cell. When your head tilts or moves in horizontal plane in any other way, otolith membrane gets displaced. Can you see that? As it is displaced, the stereocilia on the hair cells bend. As they bend, potassium channels on the hair cells are either open or closed. Does it make sense? Does it? So if this is kinocilium, this is stereocilia. If they bend towards kinocilium, cell depolarizes. If they bend away from kinocilium, cell hyperpolarizes by either opening more potassium channels or closing potassium channels. When cell is depolarized, more neurotransmitter is increased, frequency of impulses goes up. When cell is hyperpolarized, less neurotransmitter is increased, frequency of impulses goes down. Does it make sense? Let me ask you a question. How many inner ears I have? 2. So if I tilt my head to the left, in one ear, hair cells in the macula, they will depolarize. What's going to happen to hair cells in another ear? They will hyperpolarize. Because think about this. They are symmetrical. They are mirror-like. So if in one ear, stereocilia bend towards kinocilium, and in another, they will bend away. Does that make sense? Do you understand that? Huh? Say again? So they work in sort of opposite fashion, okay? Because they are mirrored. If I move to the left, and say in my left inner ear, stereocilia will go towards kinocilium. In my right inner ear, they will deflect away. Depolarization in the left, hyperpolarization in the right, I know that I'm moving to the left. Does that make sense? Do you understand that idea? The basic mechanism, the molecular mechanism is exactly the same as with hearing. It's all about potassium flow. Does that make sense? Okay? So cell, hair cell, depolarizes because of potassium influx increases. Hair cell hyperpolarizes because potassium influx decreases. Does it make sense? Got it? Now, what about rotational movements? Semicircular canals, responsible for sensation of those rotational movements. Okay, so in each semicircular canal, which is shown right here, it's an opening cross section, you have the structure called CRISTA ampullaris, and you can see the depiction of CRISTA ampullaris here. So CRISTA ampullaris consists of multiple hair cells, and hairs are embedded into the gel-like protrusion called ampullary cupula. Okay? Does that make sense? So when we start to rotate, CRISTA ampullaris deforms. I will show you it in a minute. It deforms, okay? When it deforms, it deflects the hair cells. Imagine for a second that this structure will bend to the right. It means that the hair cells will bend to the right. Does that make sense? That deflection will either hyperpolarize or depolarize the hair cells, essentially changing the frequency of action potentials. And that change and increase of action potential will be perceived as a signal. Does it make sense? Now, since we have three semicircular canals, you can see that these canals are located in three planes. Okay? Lateral, anterior, and posterior. Does that make sense? Three planes. These three planes allow you to sense the rotational movement no matter where your head goes. Whether it's like this or like this. Okay, whether it's a simple rotational move or complex rotational move that involves all three planes. Does that make sense? Now, this is what's going on during the rotation. You're standing still, and then you start to rotate, and you accelerate. Does that make sense? When you accelerate, endolymph flows in the direction opposite the direction of the rotation. Try it with a glass of water. Rotate the glass, and you will see the water will stay in the same place for some time. Does it make sense? Okay? You see what I'm saying? So, ampullary cupula bends, hair cells bend, you have excitation of hair cells because of the change in potassium flow. Then you stop. At this point, you stop, but endolymph keeps flowing, and it bends ampullary cupula again, and now you sense deceleration. Does that make sense? Think about this. I cannot do that because I cannot do the complete circle since I'm tethered. But even if I close my eyes, I know that I start rotating. Does that make sense? Now, a little sort of a trick question. What if I will start rotating, and I will rotate for a very long time with my eyes closed at the same speed? Speed will be constant, absolutely constant. And eventually somebody will tell me, rotation's over. Will I be able to tell whether I'm moving or not if the speed is constant? When you're in the plane, and you are in the plane, if there is no turbulence, there is no acceleration, deceleration going up or down, if it is at the same height, the same elevation, can you tell if the plane actually moves? No. Right? You cannot tell this because there is no acceleration. Does that make sense? You're moving in space, but since there is no acceleration, otolith membrane doesn't move. If the plane doesn't do all these kind of tricks, endolymph doesn't move. Does that make sense? Do you understand what I'm trying to tell you? If the movement happens at the constant speed, you won't be able to tell the movement and non-movement apart. If your eyes are closed, of course. Okay? So, this is what happens when you have these rotational movements. Endolymph, when you start to rotate, think about this. I start to rotate clockwise. Endolymph rotates counterclockwise. CRISTA ampullares. No, I don't have CRISTA ampullares here, but CRISTA ampullares deform. Okay, so I rotate this way, endolymph goes this way, they deform. The deformation bends stereocilia. Okay, stereocilia bend towards the kinocilium, depolarization. If they bend away from the kinocilium, hyperpolarization. Does that make sense? Frequency of impulses changes. That's perceived as a signal. Does it make sense? So essentially, the only difference between the perception of rotational movement and perception of linear movement is what actually moves. When macula perceive the linear movement, whether it's the vertical, as in sacule, or horizontal, as in utricle, otolith membrane bends stereocilia. When it's about rotational movements, it's endolymph that bends CRISTA ampullares. Okay? Now there's one interesting phenomenon associated with rotational movements. It's called NYSTAGMUS. If you would look at someone who does rotations, like this, then the eyes, when I do the rotation, my eyes drift in opposite direction, and then they jerk, and then they drift and jerk, and drift and jerk. Okay? Does that make sense? And then when I stop, they start jerking forward, because compensation from the central nervous system isn't over yet. Let me show you what it looks like. Okay. Look at the eyes. You see? They go and then jerk back, and the guy is going to stop. But the eyes, he stopped, but the eyes continue jerking. That makes sense? Just a feature of the vestibular apparatus. Okay. Now, what are the neuronal pathways to the brain? Vestibular receptors transmit the information directly to the cerebellum, because the information about the balance is critical to plan the skeletal movements. and to the vestibular nucleus. Okay. Now, vestibular nuclei then distribute that information through the oculomotor nerve, okay, to the eye. Now, oculomotor, abducens, and trochlear, and through the spinal nerves and the cranial nerve 11, the accessory nerve, to the muscles of the neck, limbs, and trunk. Think about this. When you lose balance, you try to keep it with your arms, right? That's how you do it. So that's the spinal nerves. Does that make sense? Vestibular nystagmus, oculomotor nerve. Okay, now you have to understand that vestibular apparatus by itself doesn't control your posture. Vestibular apparatus has to send the signals to the cerebellum, which then will coordinate the inputs regarding your balance with inputs from eyes and different somatic receptors like tendon organs or muscle spindles, and then will send the signals to the motor cortices to alter the activity of skeletal muscles. Vestibular apparatus doesn't control skeletal muscles, it just provides the info. Does that make sense? Okay? Now, abnormalities of vestibular apparatus. Motion sickness. Interestingly enough, we still have no idea what causes it. I mean, we don't know the exact molecular mechanism. Basically, the proposed idea about motion sickness is that it's the mismatch in terms of the sensory inputs between the vestibular apparatus and eyes. If you have ever been on a small boat and you go into the cockpit, you look at the cockpit, nothing moves. Right? It's normal, nothing moves. Especially if you don't see the horizon, the water surface, nothing moves. But your body definitely tells you the boat is moving, the boat is rocking on the waves. Okay? Eventually you will develop motion sickness. And some people are more prone to that, some people are less prone to that. Okay? The only way to treat it is to step out of the cockpit and look at the environment. Match the visual inputs and the vestibular inputs. Does that make sense? This is one of the reasons, you know, when you read in the car, it's one thing to read in the car which goes on the highway and there's no accelerations or decelerations, so they're not frequent. But if your passenger tries to read in traffic, when you have to, you know, turn left, right, and accelerate and decelerate, your passenger will likely experience motion sickness. Does it make sense? Another condition that's associated with the damage to the vestibular apparatus is called Meniere's syndrome. It actually affects cochlea, vestibula, and semicircular canals. Essentially, it's the accumulation of fluid in the inner ear. You can see that's the normal ear, and that's the swollen inner ear. Does it make sense? Okay? So, what happens? That swelling completely messes up the work of all sensory receptors, mostly, of course, maculae and CRISTA ampullaris. So, the inputs from maculae and CRISTA ampullaris through the vestibular nerve will become mismatched with the visual inputs, which leads eventually to the vertigo, nausea, and vomiting. essentially the patient experiences motion sickness without any significant motion. Okay, this time, because it's sort of, if you think about this, sort of false stimulation of those receptors. Okay, eventually hearing becomes impaired because accumulation of endolymph will damage and mechanically damage the spiral organ. Okay, causes we don't really know. Overproduction of endolymph potentially. Okay, anatomical distortion of membranous labyrinth and mixture of perilymph and endolymph may cause this condition. We don't know the exact mechanisms, the Meniere's syndrome, but there's unfortunately no successful treatment to it. Diuretics, low salt diet, anything that prevents accumulation of fluid in the endolymph may help, but it is temporary relief, and often the entire labyrinth is removed. So inputs from one labyrinth will be ablated. Does that make sense? It's more frequent than you think. 1 out of, I think, 400 people suffers from Meniere's syndrome. It is a disease of older people. It's common after the age of 60, about this. But it's not extremely rare. Okay?